Hi everybody, it's Dr. Heather Deniston with the Junk You Should Know Show. Welcome back. We are at noon on Fridays, as always, PST time, and I am with Dr. Jon Moma today, who is employed at NaturoMedica as a naturopathic physician here, and I am so excited that you are joining me today. Thank you so much.
Having me. I'm very excited.
Yeah, this is going to be great. So, guys, one of the kind of hottest things out there right now is the opportunity to get your genetics tested, your genetic history. And I get a lot of questions. I know Dr. Jon gets a lot of questions about genetic testing. And so we thought we would go over this with you because it's there is so much information that is important. There's a lot of myths out there about things to do with genetic testing, so we're gonna dive in and talk about it.
All right, let's do it.
We will. Yeah, Dr. Jon does some genetic testing interpretation, and I will tell you it's actually not easy to find physicians that do that. It's still pretty new, but what you might not know is when you order your 23andMe or whatever genetic test you choose, the data comes to you raw, which means you'll be looking at it and not really have much of an idea of what it says. There's some basics you can interpret, but you need a professional to go over the information with you, and that's one of the many things Dr. Jon does in his practice. Mm-hmm. So before we begin, will you tell me a little bit about your history? We were talking before the show, and I found out that Dr. Jon did some Peace Corps work.
I did,
so
yeah.
Tell me a little bit about that experience.
So I did my undergrad at Gonzaga University. So those of you here in the Washington State area know of Gonzaga, good basketball team.
Yes.
They're in the Sweet 16 this year in the tournament, so very excited about that. So I did an undergrad there in international relations, but I always had this really strong interest in health, and I was a hospital volunteer in high school, and I did all these service projects that are very health related.
Okay.
But my undergrad was international relations, and so it was very ambiguous. And I thought, well, what am I going to do with this? Just knowing that I had this urge to get out and experience the world a little bit, but I had this, in terms of a career, it was a little bit of an ambiguous pathway. So I decided to apply for the Peace Corps, and I had this health background, and they're like, well, hey, you should come work for us in the health sector, which I was able to go down to Nicaragua for 2 years, and I worked at a rural hospital in the jungle down there, and I got to just be amongst all of the real good work that was being done. And what it really showed me was that even these hospitals that are down there that maybe don't have the best resources, that don't have the latest and greatest pharmaceutical access or procedural access or amazing diagnostic tools, they're doing a lot of good work. Just being more of like the foundational aspects of health: diet, lifestyle, stress, sleep, family connections, social interactions, counseling. All of this makes such a huge impact on people's lives, and it really introduced me to the importance of those more foundational approaches to health. And so that's
great.
What got me back into like the health focus for a career.
I love that. So you did Gonzaga, then Peace Corps, then you went to...
And then medical school at Bastyr.
Okay.
Yeah.
And for those of you that don't know, Bastyr, we are lucky to have Bastyr here. It is one of the best naturopathic schools in the country, and so that's awesome that you had the opportunity to go there and graduate from there. That's fantastic. And so you've been in practice how long now?
This is going to be my 3rd year.
Okay, that's awesome.
Yeah.
Good for you. And I know through the community that Dr. Jon's very busy and popular, and I know that you do great work from a professional perspective as well, because I know that we've referred patients directly back and forth. So we are going to get into it. Genetic testing. So tell me a little bit about maybe why you got interested in the interpretation of. Tell me a little bit about that.
Sure. So I was, like many people, I did 23andMe, back when it was, the really hot Christmas gift to get it like in the stocking. That was about 4 years ago.
You had expensive stockings, because I'm sorry, it was like $300 when it first came out. I think
this was like $200 back when.
Oh, was it 200? Okay.
But still, I mean, it's a little bit. It's absolutely. But I did that, and it was great. I learned all about my ancestry and like what portions of Europe I came from, and I'm 1% North African, and I was like really excited about that. I was like, this is so cool.
That's cool.
And so it gave me a little bit of health data, but it was just like the fun stuff, right? Mm-hmm. Like do I have wet earwax or dry earwax? Do I have curly hair or regular? But I was like, what, I can like learn that just by going through my normal routine. It's not like anything that's going to be like clinically relevant or like change my life in a really big way. 23andMe, what they did give me was access to my X-linked, like inheritable disorders, things that like track within families really clearly, like Huntington's disease and things like this.
Okay.
But there again, you know, unless you are adopted, you're probably going to know based on, you know, just being in contact with your nuclear family or, you know, a couple generations before you, you're going to know if you have these disorders or not.
Okay.
So there again, like not a whole lot of like usable data. But I was really curious about like what else we could do, and at the same time, there's this doctor on the East Coast out of Bridgeport, Dr. Peter D'Adamo. He was putting together this program called Opus 23, and what his idea was is that we're going to take this raw data that 23andMe gives you in a text file, and it's just all of the. It's kind of like a computer code, basically. It gives you all of your different nucleotides, which is what your DNA is made out of.
Okay.
It gives you what nucleotide do you have at what position, and that determines, you know, basically the code that you are created from, like your instruction manual. So it's a long text file, completely worthless to all of us, right? Unless we have some way to decode what that actually means. So what his computer program does is we can upload it into this database, and it will parse out all of this information for us, and it will go and it will find all of these great studies that relate to, you know, your specific genome, your DNA. It will give you usable clinical data. So we get all these giant maps basically, and the maps we can use to you know, create a picture of what is the function like for most patients, like how are they functioning in certain biochemical pathways.
I think it's an important point, because one of the questions I think we need to ask is why are we doing this? Why are we getting all of this genetic information? Is it useful? Is it sometimes counterproductive, which we'll talk about in a minute, but I think it's really good to ask those questions of like, all of this more testing is available, but should we be doing it? So we're gonna get into that a little bit more. There's several kinds of tests out there now. So do you recommend 23andMe still, or are there other ones you think are useful?
Yeah, no, I do recommend 23andMe. I think that the majority of the patient population out there, like, you're going to have really good success if you do 23andMe and Ancestry Dna, both of them. They're both going to analyze different portions of your DNA for you. So, you know, 23andMe, generally my patients get about 60% of their like usable DNA data from 23andMe, and then we can fill in some gaps with Ancestry DNA's file. And so overall we're getting about 85% or so of like usable genes that have been studied, that we know that have a, you know, impact in the body. There's so many genes out there that we haven't studied, or that they just don't have an impact on function, so they're just not important to us right now. But at some point in the future maybe they will be. But for right now, you know, using Ancestry DNA, 23andMe, combine the two files together, get about 85% of your actual DNA for a really reasonable cost too. Which is a very good approach, unless we're looking at just doing more of like a, you know, matching treatments, like certain pharmaceuticals with the patient. So if we're looking at, you know, just treating anxiety, just treating depression, just treating any kind of mania or psychosis or sleep disorders or ADHD, you know, there's some really amazing testing out there that looks at just the pharmacogenetic aspect of things, looking at liver enzymes and how you're breaking down these medications, and looking at, you know, how do we change dosages, how do we, like, what kind of therapeutic drug targets do we go after, you know. So I have a lot of patients that, you know, have anxiety, right? It's a very common thing nowadays to experience. A lot of, you know, I think it's very, you know, I think it's a consequence of a lot of times of our like modern lifestyle. We have these kind of like more like mental, emotional symptoms that seem to be pretty common.
I think a lot of people don't know, don't necessarily make that connection that 23andMe could come, the data could be useful in things like people's depression and people's anxiety, that information can tailor your treatment plan specifically. And so I think that's a great conversation to have as well. But before we kind of dig into that a little bit more, I have clients and patients that are asking, you know, is the data safe? Because people have insurance through their work, they're worried about oh, their predisposition for breast cancer, their work finding out about it, or
Yeah,
whatever it
yeah.
is. So can we talk a little bit about whether you think it's safe and what precautions you suggest people take?
Yeah, well, I think that this is a huge question that was really, I think when a lot of the testing first came out, people were really concerned about this because this is very invasive into you specifically as a patient, right? And we have, I think there's a lot of risk involved with sometimes like, insurance companies, learning more about, possibility for like your insurability or like your employability with having a serious condition, right?
Yes.
But there are 3 laws that have been passed in our country that have responded to this, and one is the Americans with Disabilities Act. That's just based on the idea that you cannot be discriminated against for employment, right?
Okay.
So anything that is found, any kind of like health issues that either you're being treated for or you might have a predisposition for, you are protected there. The Affordable Care Act has some provisions in it as well that are really helpful that do discriminate against insurers denying you coverage based on pre-existing conditions.
Okay.
But the most important one was passed in 2008, and that has to do just with your genetic data. It's the Genetic Information Non-Discriminatory Act. And that's 2008. It really protects you in terms of an employment sense, in terms of an insurability sense. So you should feel pretty comfortable that there are laws out there that have been passed that unless you are actively being treated for a condition, like if you have genetic like, let's say something that's like X-linked chromosome like Huntington's disease, you're actively being treated for that. It's not it isn't something that's hidden from your health record. Then that would change things because you're actively being treated for it. But if you have, let's say, a predisposition to increased risk for cardiovascular disease, and we know that maybe your insurer might want to know that, your employer, maybe they want to know that, maybe they don't, but they're not legally able to access that information. They aren't legally able to ask you for that information.
Yeah, and I also think too, as if you're still concerned about it, all of these tests you can do under a made-up name if you want to.
Totally.
So my husband and I did we made up the most ridiculous names, and they're hilarious when your results come and it's a totally different name. And so you can do that as a third layer of protection. But I did not know about 2 of the 3 of those laws, and so that's super helpful because we are being protected externally, and then you can add that other layer if you want to. Now, who do you recommend can benefit from it? Should everybody do it? Should not everybody do it? What do you think?
No, I think generally my patients that pursue this testing, they usually fall into 2 different categories. One would be the patient that's coming in that really wants to optimize their function. Like they're pretty healthy, but they're really curious. They're like, hey, I wonder if I can be doing better than I am currently. And a lot of this testing that we get into is function. It's all about function. Like, how are you functioning? How are you detoxifying? How are you balancing your neurotransmitters? How are your hormones interacting with the receptors? Are you burning through vitamins at a higher rate than you should be? Are you predisposed to having low B12, low magnesium? Like, can we get some information based on that? And what can we do about it? And then looking forward into the patient's future, like what are maybe the predispositions, or like where are you trending towards in terms of risk? So do you have maybe a slightly increased risk of an estrogen-related disorder? Do you have increased risk for inflammation in the arteries possibly? Is there something that we need to be like thinking about in our minds to like change how we treat clinically? Like are we changing our screenings based on this? Are we changing like what we're looking for in the blood tests? Are we changing like what kind of diagnostic testing we're doing?
Yeah, and I think that knowledge is so powerful too, because we might as well talk about it now. There's a big thing of predisposition and predestiny, and so some people have a fear of going into it because maybe they have a history of breast cancer or whatever. Having the knowledge so that you can make your lifestyle choices and decisions based on actual data is a much stronger and more effective way of optimizing the human condition than anything else. So having that data, I think, is essential. And so the fear of it, finding out, really in the end, it's, I think, much better to know so you can be making these decisions. And we're going to talk about genetic expression, but just this is such a great foray into learning that because you have certain markers on your genes does not mean that you are predisposed or predestined to it does mean you're predisposed, it does not mean you're predestined to expressing those. So can we talk a little bit about gene expression and how you as a physician, you see some of these things on patients 23andMe, and how do you teach them to have the best opportunity to express good genes versus some of the ones that have markers that we're not too excited about?
Yeah, absolutely. So, I get this question all the time. It's like, I have this set of, data basically in front of me, and some of there's, sometimes there's risk, right? There's risk that shows, oh, well, you might have an enzyme that's not functioning appropriately. It's giving you this result, or, you have maybe this predisposition towards developing, maybe possibly some sort of a cancer or something, right? What do I do about it? Like, why do I care? If I can't change it, why would I even want to know, right?
Right, great.
But the fact is that you can change it. Honestly, you absolutely can. And there's two ways that we use this information clinically. One is going to be either to understand more about the enzymes, because enzymes control the body. Enzymes, you have biochemical pathways in the body that are controlled by these enzymes, and the DNA determines what amino acids go into the proteins that form those enzymes. And so if you have a certain set of amino acids with a certain shape, and they create a certain shape of a protein, and then the proteins fold in a certain way, it will change the shape of the enzyme. This is the whole idea behind genetic testing, is the shape of the enzyme determines function.
Yes.
So if your enzyme is shaped in a certain way, maybe it's only 80% efficient. At that point, usually if it's below 75, I want to try to speed it up a little bit, or I want to try to ameliorate the effect, the downstream effect. So the two ways that we can do that is we look at the research. That's where programs like the Opus 23 platform that Dr. D'Adamo created comes into play, because we can use that and say, well, what does the research tell us about that enzyme? For instance, there's an enzyme that takes beta carotene and it converts it into vitamin A. Really important for the body to have this like retinol, antioxidant, vitamin A. Super important. So if your enzyme is slowed down, you're going to the effect of that is the low vitamin A level in the body. That you need to either be eating more beta carotene, supplementing with beta carotene, or we can look at the research and say, well, what does the research say about maybe the cofactors for the enzyme?
Yeah.
Are there nutrients that we know that enzyme needs to be able to operate efficiently? So maybe it's a B6, or maybe it's magnesium, or maybe it's zinc, or something that I can give you to speed up the function of the enzyme. Or we look at, are there substances that we know about, or environmental conditions that change the genetic expression of the genes that code for that enzyme.
Yeah.
So can I create more copies of the enzyme, basically? So either can I speed it up or slow it down, or can I just create more copies of it?
Yeah.
So that way the overall effect is more vitamin A in the body, or whatever the enzyme is.
Yeah, exactly.
Just create more copies. So sometimes that's meditation. Sometimes that's working on stress or sleep. Sometimes that's something like an herbal medicine, that we know that this herb does this thing in the body. It enhances the genetic expression of these genes, which code for this enzyme. So overall, there's always things, and the great thing is that genetic medicine is always evolving.
Fast.
It's so fast, and so these worldwide databases of information that we have, they change every year. I mean, year over year, it's exponential. In the studies coming out of China and Israel and the Middle East and Russia and the United States, and all these really amazing genetic medicine centers of the world are publishing all the time. And so you can do this test one time and know this is my DNA, and then over a period of time you'll just be getting more and more information about your genetic makeup as more information becomes available. So you can benefit from this today, but then also 5 years from now you might be able to.
The only way to optimize is through data, and that if you are not taking data, studying data, looking at data, then optimizing your own humanness and the potential that you hope to achieve is going to be impeded, for sure. So I love that this 23andMe or whatever genetic testing is giving us just such a wealth of data to use when we want to make ourselves as best as we possibly can. And I like that you touched on that genetic expression is affected by whole food nutrition, exercise, movement, meditation, managing stress levels, sleep, what types of herbal remedies you use, vitamins and nutrients. Those are all so powerful. And Pam Peake, I think, says, you know, your DNA is the gun. What epigenetics is what pulls the trigger. So it's, you know, your lifestyle factors are what's going to pull that trigger and express certain genes over other genes. And so I think that's really key. And the 23andMe test is such a great place to start for that.
I think so.
I think so too. So
yeah.
What can we learn? Let's talk some specifics, like cardiovascular. If I have that, what kinds of things can I learn?
Yeah, so I mean, I feel like patients that have a strong family history, or ones that, you know, already have maybe a diagnosis of high cholesterol or high blood pressure, or they're noticing maybe some inflammation in the arteries by blood tests, then we can look and say, well, maybe there's something genetic going on that we need to be more concerned about. And, sometimes it's you know, just looking at the burden of inflammatory substances in the arteries. One is that we use a lot is homocysteine values, and we know that's very much so based on your genes. And there are enzymes in the body that are responsible for converting that homocysteine into methionine. And homocysteine is an inflammatory substance. Methionine is more benign. So you have this enzyme, mTRR enzyme, and it needs B vitamins to function well. And you can have varying levels of activity in the enzyme. And if you have a low functioning mTRR enzyme, then you're going to need to be intaking B vitamins, B12 especially, really important. So just looking at that, it gives you a therapeutic pathway basically to address your homocysteine values. Otherwise, you know, I think you know, looking at how your good cholesterol versus your bad cholesterol, the interaction between the two, we know that knowing a patient's ratio is so important. You know, those HDL molecules, the good cholesterol, so important. It's like little vacuum cleaners going around picking up all the bad particles. And then the LDL, we know the bad cholesterol is more of your inflammatory, oxidative, you know, damaging to the arteries. You have an enzyme, the CETP enzyme. It basically is the reason, or it's not the reason, but it's the functioning mechanism of how the HDL cleans up after the LDLs. And so you can have varying levels of function in that as well. And just looking at, you know, is that compromised in some way, and what do we need to do about that? You know, can we make sure that we're prioritizing increasing the HDLs? Can we prioritize, you know, dietary changes that take some pressure off of the LDL? You know, more like low carb focus, to like work on triglyceride values and things like this. Yeah,
I think that's great. And I think one of the things, and correct me if I'm wrong, but the test helps you prioritize some of the key factors that you want to be working on. And I know when you get patients in, it was the same with me, they come in with a whole host of complaints, and knowing where to throw the first dart is sometimes hard for the practitioner and certainly hard for the patient. And I think sometimes that genetic testing can highlight, oh, I see, there's a much like way down deep foundational issue why you might be having this, and this. So let's address down here.
Yeah, and I think that is just like, that is medicine in a nutshell right there, because that is always the biggest battle. Is like, how many layers do you have to peel back before you get to the thing? Like, what is the core thing that we really need to be addressing, the cause of what's going on? And you know, you can do blood tests all day. You can look at hormone values. You can look at thyroid function. You can look at vitamins. You can look at, you know, all of these different markers. But you know, sometimes those are just a symptom of a greater thing. You know, and where can we relate back to that one focal point? Sometimes it is genetics. You know, I think this test is really I think necessary and very ideal for someone who has, you know, seen a few different doctors, and they're either struggling with a diagnosis, or they're struggling with you know, a improvement in their symptoms. Nothing seems to fit. You know, sometimes it is taking a step back all the way to your genetic pathway and looking at, well, is there something going on genetically that we can put our finger on? Yeah,
I like that. Now, there's a lot of folks out there that are dealing with neurotransmitter issues, anxiety, depression, and it is a slippery thing to diagnose and to treat. So how does genetic testing help you target those particular issues more effectively?
Yeah, and this is where I've been so impressed with the type of testing that's available. And 23andMe and Ancestry Dna, those raw data files do give you some access to some of these enzymes that are so important when it comes to breaking up some of your fight or flight hormone neurotransmitters and that. So we know like epinephrine, norepinephrine, dopamine, serotonin, these are all really important in the balance between how do we feel, where is our resting our resting, like our nervous system balance, right?
Yes.
Is it more towards the fight or flight, or is it more towards like the rest and digest, like relax?
Which is where it should be.
Which is where it should be.
Yeah.
But we can get stuck in these patterns, and we can get stuck in this tendency to shoot in one direction over the other. And so a lot of times it's looking at there's 3 enzymes that we look at that really, I think, determine where that balance point is going to be. So you have your MAOA, MAOB enzymes, and then your COMT enzyme. And the COMT is really one of my favorite therapeutic targets to look at. It's catecholamines, which are your fight or flight neurotransmitters, and it's responsible for breaking those up. So if we have a slowdown in our COMT, we're going to have more epinephrine, more dopamine,
more tendency toward fight or flight then?
And even so, if you have a situation that kind of like puts you over that edge, gets you into that like fight or flight mode, it takes so much longer for you to come back down to normal at that point, because that enzyme is slow, breaking up the epinephrine and the norepinephrine, getting you back down to a resting point. It takes a lot longer. So you can have all of these issues, these things that can come up in the normal course of a day that kind of heighten that nervous system response, traffic, and something at work happens, or something with your family, or issues. The telemarketer calls you, and you're like, oh my gosh, I want to yell at them. But all these things that happen during the day, maybe you never get a chance to come back down to the normal level.
Yeah. So you're saying that 23andMe gives you sort of relative predisposition to those enzyme balances?
Yeah. Okay. We can actually take a look at it and see, this person's COMT is functioning at 60%, and then what is the implication there? Then at that point, it's been so well researched, that enzyme is so well researched that we know what are the cofactors, we know what are the things that enhance the therapeutic expression. So we can actually give a treatment plan based on someone's COMT enzyme, and then speed things back up, which is great. Otherwise, and I think this is where I've been really impressed, is there are a lot of novel testing options out there. Other companies, they're doing great work within the field of pharmacogenetics, looking at just matching a patient with the appropriate drugs, with like the drug targets, and like looking at liver enzymes and how they break these things up. So, for instance, if you have a patient who is predisposed to moderate anxiety, and been on, let's say they've been on Lexapro or some sort of like an SSRI medication, and it's not working, it's moderately effective, but they're getting some side effects, and they're kind of wondering, what else is out there. We can run these tests really easy. A lot of times they're covered by insurance too, which is great. And you can get a list of the most ideal medications for that patient based on their genes, which is great. So maybe it's not an SSRI medication that works on the serotonin level. Maybe it's an SNRI medication that's most ideal for them. Switching them from a Lexapro to a Wellbutrin, you get a ton of more, so much more effect in terms of looking at like the personalized medicine approach. Because that is always our goal, right? Always our goal is to look at each patient as a unique individual and say, like, how can I personalize this treatment plan for you? And I think genetics really lends the ability to personalize medicine.
I think that's great too, and I think even taking your comments a little further, and that is if someone has been on synthetic pharmaceuticals for anxiety, depression, 23andMe is just going to give you that much more information if we're working to get them off them, and we want to maybe go with something more natural as an option, and also a great educational tool in genetic expression of, okay, well, how about we start talking whole food and exercise and movement, and applying some of those things first. So I think it's great information for the physician and great information for the patient.
Absolutely.
So we've said this, 23andMe does not, it comes as raw data, it does not come with an interpretation. And so if because I'll be honest, when I first got mine, I called all over town, and at that time nobody was doing interpretation. There were a couple online options where you could send your 23andMe data and they would give you some interpretation, but it wasn't thorough. So tell me a little bit about if someone's looking for, how do they find a doc who can do some interpretation, and then a little bit about kind of how you process through folks who are wanting to come in and take a look at that with you.
Yeah, absolutely. So I think that 23andMe is a means to an end. Honestly, I mean they're going to give you some great information. Ancestry Dna, the same kind of thing. Good information about your family history and a couple of your traits here and there, but they aren't a healthcare organization.
Right.
They don't have. They can't diagnose, they can't treat legally. They just can't do these things. So we need to have a third party involved in this. And so what I do, how I function for most patients is that they will get me their raw data file. We keep it on our secure server just for a small period of time. And we use that information to upload to a database that gives us all of this biochemical data. That's clinically relevant, because that's the key, is how do we get to the clinically relevant stage of,
exactly
get
through all the minutia to stuff that matters to the patient.
So then I will go in, and it usually takes me about an hour and a half or so. I'll go in and I will curate a report that's specifically for the patient. I'll have them fill out a questionnaire that says, these are my health goals, these are my conditions, these are my medications, this is my family history, and then this is what I really want to learn. Either this is my patient already and we already know what our goals are, that is very nice, or if it's a patient that's coming to us from out of state, or it's being referred to us from a different clinic, they'll fill out this questionnaire. That way it really focuses me on where do I actually navigate their data, how do I go in, what pathways do I really prioritize, and then I will come up with a report. And the report is it's generally takes about 90 minutes to go through with somebody. It's going to have all of their high value genes that we need to be addressing. It has some really great information clinically about risks of in terms of detoxification or cardiovascular or hormones or whatever it is. We can get some good usable kind of just some good factual information about where do we go for how do we keep you safe, how do we optimize some things, what kind of supplement routines might be most ideal for you.
I love
has
that.
A bit about diet as well, and this diet is not so much in terms of what might you be allergic to, but it's more like what types of nutrients do we want to prioritize. Are you really lacking in terms of your genetics for magnesium and vitamin B6? Well, what foods have a lot of magnesium and vitamin B6? Where can you snack on things that throughout the day that have a lot of magnesium and B6?
Yeah, that's great.
And then it'll have a little bit about pharmaceuticals as well, and we get a good list on what is your most ideal for blood pressure. What kind of a therapeutic would be based on your genes. Where would you respond? What would be your first line therapeutic for blood pressure, or pain medication? It has some information about pain medication, things like that too.
That sounds super thorough. What does if somebody's just calling NaturoMedica here in Issaquah and they've already gotten their 23andMe results, what do you charge for an evaluation on that, or an interpretation?
Certainly. Absolutely. So we'll have them go through the process. If they already have their data, we'll have them fill out the questionnaire, and then there's an analysis fee that they have to pay, because we have to pay a licensing fee every time we would use the software to be able to run the information. So we charge $129 for that includes the materials to compile the report, and then the software fee as well.
That's great.
And then I'll charge $299 for a 90-minute consult. That's either over the phone or in person, and you have this great binder of information. It's all printed out in paper form, very easy to read, and then you also have it on a flash drive as well.
And it's so worth it, because this is data that you're going to be able to use for the rest of your life, and it is such a great reference tool for you. I'm not sure that there's ever anything that you could get that would be more comprehensive and better than this. So I think that's great. And Dr. Jon, you do work remotely, so if someone is in Toronto or someone is across the states, they can just call the office and organize a face-to-face with you via Skype or FaceTime or whatever.
We've done that before,
Okay, that's great. So guys, I hope this was helpful for you. We went through a lot of material. If you have any other questions, please put it in the comments below. Dr. Jon and I will be kind of hovering over those comments and making sure we answer any questions for you. And we'll be putting a few links down below as well, so make sure you're interacting down there. Share this with your friends and family, because lots of people are very interested in this information right now, and this is a good way to kind of get them a synopsis of why they'd want to do it, is it safe, and what kinds of things they can learn from it. So Dr. Jon, thank you so much for joining me today. I so appreciate it. I'm sure we'll see you again. And thanks everybody for watching, and we'll see you next Friday. Bye-bye.